in men. So as we see, the prostate is an organ that wraps around the urethra of men. Only men have prostates, women don't have them, so we're in a way saved from this condition. But as men grow, particularly when they reach age 40, that prostate starts growing. And as it grows, because it encircles the urethra, it tightens the urethra so that the outflow of urine from the bladder becomes weaker and more difficult. So it's a very common disease. Unfortunately, we haven't really done very good studies in the Philippines to see how common it is, but the trend all over the world is that it is one of the most common problems that bring a man to the doctor. So in the US data, this is even an old data, but the trend is the same. An enlarged prostate is the fourth most common disease diagnosed in men who are above 50 years old. And BPH is a progressive disease. You can't stop it as long as the man is aging. That will continue, that prostate will continue to grow, and that prostate will eventually, if not yet, cause problems. And as time goes by, those problems really get worse. So either symptoms, the most common manifestation of that progression is the symptoms get to be more severe. Unfortunately, they will really get so severe that one of the most common complications of an enlarged prostate is that a man will eventually not be able to urinate. So, just can't void. And that's, you see that as years go by, nearly about 2 to even 6% of patients will really need a catheter in there so that the urine that's been there for a long time will need to come out. I have seen a lot of men, unfortunately, in my practice, that the first time that they will see a doctor is because a catheter has been placed on them. And they say that it's really the most excruciating pain that they've ever suffered. I guess that's the equivalent of giving birth, they say, for women. Not being able to void in men is the equivalent. And because such severe symptoms, or even, really not being able to urinate, a good percentage of them will eventually need to undergo surgery because the condition has been so severe and causing complications already. So that's how important the condition is. Now, so how will we know that the patient is already, as I said, all men will eventually have their prostates grow big. But what matters is when that big prostate starts giving them problems. And what are these problems? What are these symptoms? Okay? So we have what we call as storage symptoms or voiding symptoms, but in general, it's increased frequency of having to go to the toilet during the day as well as during the night. So that's nocturia, frequent voiding at night. Or urgency, or needing to rush to the toilet the moment they have this feeling of needing to pass urine. Now, but the more common problem that brings the patient to the doctor are these voiding symptoms, meaning they take a long time to start their void, they're weak, their stream, urinary stream becomes very weak or intermittent, putol-putol yung paglabas ng ihe. They have to strain to start, to continue, and to empty their bladders. And sometimes they have splitting or spraying of the urine. And then eventually, sometimes they have this feeling that even after they void, they feel that there's still something there that's left inside. Now, to make that, all these, for you to remember all these symptoms, okay, for us, doctors, we actually, when we start asking patients, what are your symptoms, we have this code or mnemonics that we use, and that's fun-wise. Frequency, F, urgency, U, nocturia, so that's the fun. And then wise is weak stream, intermittency, straining, and unable to empty. So that's the E there. So those are the 7 symptoms that we ask commonly to our patients to see how much that enlarged prostate is actually causing problems as far as their voiding is concerned. So once we see them, what do you expect the patient to undergo through as we see them and assess them for their benign prostatic hyperplasia. Of course, we do a medical history, what are their other diseases, what other drugs they're taking. We do a simple urine test to see whether he has an infection or he has possibly other urological problems that may be causing the symptoms and not just a benign prostatic enlargement. Then we do this IPSS. That's actually the fun-wise. We do a scoring system. We check all these 7 symptoms and look at how severe they suffer from these symptoms. So this scoring system allows us to classify them. Are they in the mild part of the disease? Are they moderate cases already, or are they severe cases of BPH? So we score them. And we also use this scoring to monitor them. Are they actually getting better, or are they getting worse as we manage them? We do the simplest way to check whether they do have an enlarged prostate that we can do in the clinic is to do a prostate exam, and that means inserting our finger into the patient's rectum and feel for that prostate. Normally, a normal prostate, we can't really feel that, but once we already we can feel a bulging prostate there, then that's a sign for us that yes, it is an enlarged prostate. So that is, I guess, a bit uncomfortable, but most patients will generally go through this disease okay, this examination fine, and that's the simplest thing that we can do to check the size of the prostate. Now, because they have symptoms, we have to check, is this just a benign disease, meaning it's the normal enlargement of the prostate that goes with aging, or is this already a case of prostate cancer, which is a totally different disease altogether. And depending on our examination, depending on the presence of family history of prostate cancer or breast cancer with the patient, what we examine, the symptoms, we may need to further work up the patient for the presence of prostate cancer, so we do a simple blood test, PSA or prostate-specific antigen, and that will already give us some idea if we are dealing with a case of cancer of the prostate or just the normal enlargement of the prostate as men age. And for patients who have very severe frequency, urgency, and nocturia, we ask them to do a diary. Note down every time they have to go to the toilet, the time, and measure the amount of urine. And then we can assess this more on their next checks with us. So these are the things that a normal patient will have to go through on their first consult, and then we go through some of them on their follow-up consult.